patients with atrial fibrillation who underwent rhythm control within 1 year of diagnosis, a significant treatment effect was observed compared to rate control in those with an eGFR of 15 to 60. However, in patients with eGFR below 15 or those undergoing dialysis, the comparative effectiveness of rhythm control was reduced, while the adverse event risk tended to increase. Hello, my name is Dong-Sung Kang. I am an assistant professor in the Division of Cardiology at Harlem University Sacred Heart Hospital. I'm the first author of the manuscript titled Early Rhythm Control for Atrial Fibrillation in Patients with End-Stage or Chronic Kidney Disease, which is scheduled for publication in the April issue of Mayo Clinic Proceedings. This study aimed to evaluate the comparative effectiveness and safety of early rhythm control versus rate control in patients with chronic kidney disease, including those with end-stage kidney disease. We included 1,660 patients with CKD and 3,564 patients with CKD stage 3 to 4 who were newly diagnosed with atrial fibrillation and received treatment between 2005 and 2016. The primary composite outcome consisted of cardiovascular death, ischemic stroke, heart failure hospitalization, and acute myocardial infarction. Over a median follow-up of 3.5 years, early rhythm control in patients with CKD stage 3 to 4 was associated with a 15% reduction in the risk of the primary composite outcome compared to rate control, with no significant difference in adverse events between the two treatment strategies. In contrast, among patients with ESKD, there was no significant difference in the primary composite outcome between early rhythm control and rate control. However, the early rhythm control group exhibited a higher incidence of treatment-related adverse events. These findings suggest that the risk-benefit profile of early rhythm control might be less favorable in patients with ESKD. Unlike previous studies on early rhythm control, our findings identify a patient group that might not fully benefit from early rhythm control. This highlights the need for physicians to consider renal function as an important factor when determining initial treatment strategies for patients with atrial fibrillation. Furthermore, the higher risk of treatment-related adverse events in patients with ESKD suggested the need for closer monitoring and more proactive management when implementing early rhythm control. In this study, most patients who underwent early rhythm control were prescribed antiarrhythmic drugs. Since the metabolism of antiarrhythmic drugs largely depends on renal function, the risk of treatment-related adverse events associated with rhythm control might inevitably increase. However, the use of catheter ablation, which provides a more potent antiarrhythmic effect while reducing the need for antiarrhythmic drugs and their associated adverse effects, has been increasing in recent years. Therefore, further studies are needed to determine whether patients with ESKD who receive catheter ablation for rhythm control have better outcomes compared to those managed with rate control.
We hope that you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you will find access to information for our social media content, such as additional videos on our YouTube channel, www.youtube.com Mayo Proceedings, or journal updates on Facebook, www.facebook.com Mayo Clinic Proceedings. You can also follow us on X, formerly known as Twitter, available at Mayo Proceedings. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This content is copyrighted by Mayo Foundation for Medical Education and Research. published by Elsevier Incorporated. All rights are reserved, including those for text and data mining, AI training, and similar technologies.